Today's video brought to you by Yes, but. So today was the big day. We've been waiting for since treatment ended to find out if treatment worked, get all those results and figure out all those things. And so, I would say overall today, great news. Great news.
Yeah, I'm really pleased with the news.
With some hanging
caveats,
information.
But, I imagine we're going to be there, kind of always.
Yeah.
There's always going to be something that's out there.
Yeah.
That we need to make sure that we're aware of right now.
Once you have a cancer diagnosis, you always do. You're never not a cancer person, whether you're a survivor or whatever. I think I said today, I don't know if I'm being chased by a bear or I'm not being chased by a bear, or maybe I just live in a forest where bears might exist. So
I think it's the last one there now.
Right now, we live in a forest where bears might exist. So what do those look like? First of all, today, PET scan.
Yeah, so the PET scan did not show any obvious metastasis in the rest of the body right now. So that was great news. They have to go over it frame by frame and all that, but overall, it looked good, and it's really the news that we were hoping to see.
Yeah, so this is the yes, but. So our rad-onc, who is a head and neck specialist, looked at it today primarily in the head and neck because that is his specialty. And he said, this couldn't look better to me at this stage. He also said, literally, word for word, I don't have the patience to look at this frame by frame. Somebody else is going to have to look at it, which is fair. That is not his job. So his global view was, this looks pretty good. So that's we think it looks pretty good. He said it looks great. But we haven't had that really granular look. And once the radiologist looks at the granular stuff, we may see stuff that we didn't see before. But right now, if everything looks the way it looks on the surface, the PET scan looks great.
Yeah, and I think that from a layman's perspective, there's terms that I've heard my whole life, like cancer is in remission, or you're cancer free, and none of those feel good to me in terms of really representing kind of where we're at. I think that right now we don't see any metastasis. No, I can't even do it again today.
Metastases. No, you're out. You're done.
I'm done. Okay.
Yes, but Tim can't say metastases.
Metastases. There we go. I did it. So we don't see any right now, and
according to the guy who doesn't look line by line,
frame by frame. Yeah. So, but we're happy with the results there. There was nothing that came back that was like, this thing is nasty and all that kind of jazz.
That very scary. Oh, everybody stop. That we didn't see that today. So that was thing one. Thing two is that you have this ulcer. We knew that going into today. It was something that we were worried about. And
just to clarify, it's an oropharyngeal ulcer, and it's right where my surgery was.
Yeah, so you've got this spot. If you've ever gotten a lip ulcer or a tongue ulcer, whatever, it kind of looks like that. It's about 2 to 3 millimeters. So
centimeters.
Centimeters.
Yeah.
Big.
Yeah.
It's a big thing.
Yeah.
We looked at it on the scope today, and there's a lot of potential concerns around that. But none of them apply today.
Right.
Everything that we know right now says that ulcer is a typical part of healing. The research says that about 88% of people get those, that they resolve around 3.6 months, that they, by the numbers, about 30% of those tend to be disease progression. So whatever. But right now, your PET scan didn't look hot in that area. In fact, it looked cool. The head and neck guy said remarkably cool. So there isn't anything that's really concerning that is disease progression right now. So that's a really wonderful thing. So right now, today, the thing that we have to do is just maintain progress with that ulcer.
Yeah, and his recommendation or focus is maintaining my diet and making sure that I'm getting enough protein, 1 milligram per kilogram. And making sure that we do great oral care. So fluoride trays and rinses and those types of things to make sure that everything in the area is as clean as possible.
Right. So
good oral hygiene. Oral hygiene.
No, you got nothing.
I got nothing today. It's not true.
Your diction is questionable.
For 3 in the afternoon, yeah. It's true.
For a guy with the oral cancer, it's not too bad.
It's a lot better than it's been. You guys can tell that.
Yeah. So the ulcers, what they expect it to be, there isn't anything right now that indicates that we need to change the way that we're doing things other than these really good proactive things. Great diet, great oral care. We need to start addressing your trismus, the amount of that you can open your mouth. So all of those things we will continue to do. So that's kind of like staying the course.
Right.
The but of that is if things change with that ulcer can take 2 paths. There's like a Y in the forest with the bears. And one of those paths is non-malignant. Yeah, you're rubbing off on me. Wow. Non-malignant, but not unproblematic. And one of them is malignant or disease progression. So on the non-malignant side, the biggest concern is that ulcer represents a process towards necrosis, that the tissue is dying, that you're not getting enough blood supply, which we know is true, and that's not going to heal well, that necrosis will continue to kind of creep into your jawbone, your teeth, and the ramifications of that are pretty severe. People, lose their teeth, they lose their jaw, they get sepsis. You can become very ill. You can die from just that necrosis process, and it doesn't have to be cancer. So that's one path that if things don't go well, this ulcer still could be problematic. The other path is that if it is malignant, if it is disease progression, if it is cancer that is continued, obviously that's bad also. And that's bad in potentially a different way. The way the radiologist described it to us today, that if it is cancer, it's kind of game over. That's an aggressive cancer that's too aggressive for them to do really anything with where treatment is concerned. And so whether it's cancer today or whether it's cancer in 3 months when we look at it again, there isn't a treatment option for that that's really viable. So
it's going to make a significant difference, or be curative, I guess is the best way to say that, right?
If what they did in treatment before didn't manage the cancer, then the cancer is outside of the ability to manage with treatment. So that really left us with, what do we do about a biopsy? Because that was our big question last time, is are we going to biopsy? And what do we do with that? And the doctor said no biopsy. In fact, he told us that in our chart. And he didn't just say no biopsy. He said no biopsy in all caps with like all these exclamation marks. So we knew we were going to have an interesting conversation today. And it sounded like, well, why don't we biopsy? He says, no, you never biopsy. And
for this at this point,
right? I mean, in this case, and I said, how do you know it's not cancer? And he said, because I said so, which is great. It's always wonderful to have a relationship with your doctor when he can tell you because I said so. And I trust that. But he then went on to explain that all of the other things don't really show that this could be cancer. It is reasonable for us to expect that it's not cancer. But if it is cancer, the horse is out of the barn. There isn't really anything that we can do to change it. And the biopsy has a lot of risks.
Yeah, and most importantly, we've got to get that tissue healed. And so what's going to heal the tissue? Time and good oral hygiene and those types of things.
And protein. And they're giving you a medicine to increase blood flow.
Yeah.
And that's the biggest reason not to do biopsy is that this tissue that's in that area where they did surgery that took a huge assault.
Whack.
I mean, they cut it out and then they burned it out and then they did all those things.
And then we radiated it.
Yeah. That tissue is compromised. It doesn't have enough blood flow. It doesn't have what it needs to really be healthy tissue. And going in and biopsying it is another assault to that tissue, and it may not recover from that. It doesn't have enough blood flow. It doesn't have what it needs. And so the risk is too high to do a biopsy to be worth it, given that it doesn't look like cancer right now. And if it was cancer,
It's
really isn't
a really aggressive one. Anyway,
there really isn't anything that we can do about it. So no biopsy. We are going to continue to do what we've been doing. We're going to add a couple of new medications and a couple of new doctors. We're going to see a functional medical doctor that's going to help with jaw movement, so quality of life is as good as it can be. And we're going to build a little house in the forest with the bears. But they're not chasing us right now.
And then wait around another 3 months.
And then 3 more months.
Yeah.
And see what happens.
Yeah.
All right.
Very good.
There we go.